Hey guys, Greg Mundis from San Diego. Just got done with a session here at IMAST. It was the first Cases and Cocktails, and we did a session on new technology and adult deformity. Really good conversation. A lot of really good feedback. A lot of people in deep discussion about like which technologies they prefer to do different kinds of spine surgery and adult deformity. And honestly, it was just a great time to be with friends and to learn together. So thanks for everything.
Hi, I'm Bobby Slack and was fortunate enough to moderate the session of Scotch on the Rocks, Innovations in MIS for Spine. We had a great conversation, very dialogue-oriented, and a heated debate on occasion for several cases that involved MIS applications in deformity and degenerative surgery. So the attendees were wonderful and engaged, and I thought everybody took away a lot of great nuggets to practice with at home.
So hi, my name is Baron Zarate. I hosted the session, the Spine and Scotch session on how to avoid surgical complications in the AIS surgical treatment. It was a great session. 4 cases were presented, and there were an opportunity to discuss that in tables, in smaller groups, and also have a discussion in the whole group. So a lot of big and important information were shared, and it was a great session. Thank you.
Hi, my name is Dr. Kristen Jones, and this is my co-chair of IMAST 2025.
Yeah, and my name is Meriçen Ercan from Istanbul.
We just finished moderating the White Cloud Award nominated session. So we had 15 papers for both basic science and clinical science, and there were some fantastic discussions.
Yeah.
We had molecular-based preoperative risk stratification questions. We had device questions. We had basically how we're going to revolutionize the practice of traction and preoperative care. So lots of good topics.
And we discuss how data, technology, and when we use it properly, how we can impact our patients' healthcare in a good way. So it's really excellent session.
Great session. We're really grateful to all of our presenters and looking forward to awarding the White Cloud Award tomorrow.
Hi, I'm Ahmet Alanay, past president of Eurospine.
And I'm Christoph Siepe, the secretary of Eurospine.
So we together moderated the Eurospine session on endoscopic lumbar surgery from decompression to fusion. And we discuss about the state of the art technology, but not only that, also the future of endoscopic surgery in the lumbar spine.
So the session gives you a pretty good overview over the endoscopic technique, which is an emergent technology. From uniportal techniques, we talked about biportal techniques, all the way to endoscopic fusion, what to expect when you go through the learning curve. And so the session gave you a good overview over the technique and what you can do and where the advantages are and where maybe possible challenges lie.
Hi, my name is Peter Pashas.
And I'm Stefan Parent.
And we just moderated the session 3A on innovation, AI, and machine learning. And we had an excellent discussion, excellent presentations on really innovative concepts that range from predicting clinical outcomes, complications, as well as diagnostic imaging and normative alignment. And Dr. Parent, I thought the discussion was excellent. What was your feedback?
I think that Larry Linke put it best. I think that we're scratching the surface on this topic. We're really needing big data to be able to better understand how our patients are performing post-op or their quality of life is affected. But this is really the future of spine surgery. So very interesting session, well attended, lively discussions.
Yeah, and as mentioned, this is only a topic that's going to get more involved in the work that we do and have a larger role in how we treat these patients. And I think that's reflected in the interest and the amount of abstracts we're seeing on this topic. So I'd like to thank IMAST for putting on this session, and I'd like to thank my co-moderator for an excellent session.
Hi, my name is Girish Swami. I'm an orthopedic spinal consultant at the North and Norwich University Hospitals. I'm also the British Association of Spine Surgeons education lead.
Hi, I'm Edward Bailey. I'm the British Scoliosis Society education lead, and I work in Nottingham as a paediatric spinal surgeon. And we've just been moderating session 3B.
The topics that were discussed were ODEP rating and beyond compliance. This is key for not only our industry partners, but also for us as surgeons, and also for our patients to know that the implants that are being used is actually nice, safe, and has been validated.
Next talk was by Ashley Cole on the British Spine Registry and how it's evolved and how it should ideally be used now with what we input into it, but also getting useful data out of it and using it as a research portal for high-profile trials.
Hi, my name is Per Trobisch, and I'm here with my co-moderator.
Yes, I'm Trey Crawford from the Leatherman Spine Center in Louisville, Kentucky.
And we just had the chance and the pleasure and honor to moderate the session, Innovation in Spine Surgery and How It's going to Change Your Practice. And this is really what IMAST stands for. This is here we're discussing innovation. We're discussing the good, but also the bad of innovation and how it really impacts our practice.
Absolutely. I think we had 6 wonderful presentations, broad spectrum of surgical techniques and different patient populations. I think it was very impactful.
Hello, I'm Josh Pace from Philadelphia.
And I'm Javier Pisones from Madrid, Spain.
And we were moderators for the degenerative and kyphosis section. Again, a great session as always. I think several of the key points we found were just sort of reiterated the value of MIS surgery, even in the obese population. It showed expedited recoveries and improved results.
And the other thing we saw is that you should operate on the hip before you operate on the spine, and the real importance and the role of hypotension for cognitive dysfunction.
I think a quick shout out to the mentors who we had a large number of medical students and trainees who did an excellent job. So I think that's emblematic of the society of promoting the future stars and having those mentors foster that. So it's great to see them on the podium. Thank you.
Right, hi, I'm Zishan Sardar. We just finished our session on cervical spine at the 32nd IMAST here in Glasgow, Scotland. Lots of interesting talks we heard about. We heard about a new classification system on cervical spine deformity and treatment. We heard about different ways to assess fusion in patients who've had cervical spine surgery. We heard some great talks on treatment of pediatric problems when it comes to cervical spine, and some innovative and new techniques on placing instrumentation in kids with abnormal anatomy. Lots of interesting talks, a great discussion on complex problems related to the cervical spine. So thank you again for everyone who attended.
Hi, I'm Noelle Larson. Greetings from IMAST.
And I'm Firoz Mianji, and I'm from Vancouver, British Columbia.
We had a great session on adolescent idiopathic scoliosis and learned about rates of neuromonitoring alerts, as well as roles for bracing, nighttime bracing versus daytime bracing.
Yeah, it was an excellent session, great discussion. I would encourage everybody to look through the abstracts and some really important knowledge we gained on, as Noel said, on intraoperative monitoring alerts in AIS and what to do with bracing failures.
Hello, I'm Ron El Hawari from Boston, and myself and co-moderator Lindsay Andres had the opportunity to moderate the abstract session on early onset scoliosis, neuromuscular, and basic science. A lot of great basic science talks talking about genetics and etiology of scoliosis. A few clinical talks. The group from Texas Scottish Rite outlined their 40-year history and complications associated with halo gravity traction. My co-moderator Lindsay had talked about room temperature and the effects on surgical outcomes and patient temperature, and many, many other practical talks. It was a very stimulating session, and the speakers were all fabulous, and enjoy the meeting.
I'm Lindsay Andres, and I had the pleasure of moderating with Dr. Ron El Hawari the session on early onset scoliosis, neuromuscular, and basic science. So we started off with some EOS talks, including some new techniques for controlling aggressive curves in small children, and also talked about the sagittal profile impacts of hemivertebrae in the lumbosacral region. And then we transitioned over into some quality improvement initiatives, and we heard about the importance of having a dedicated anesthesia spine team that you can take back to your institution. And we finished up with some really stimulating basic science talks on trying to take that I out of AIS, and also maybe some new techniques we can steal from the orthodontists to fixate cervical spines when you don't have great options for screws. So we really enjoyed the session and hope you enjoy your time in Glasgow.
Hi, I'm Serena Hu, and I just finished moderating a session with Ferran Pellicer on adult spine deformity topics. We had a lively discussion with a number of very varied talks, ranging from risk factors for PJK and some of those variables, to gait analysis, to the fact that GLP-1 agonists seem to decrease the length of stay for certain patients. It was a lively discussion. All the speakers gave great talks, and there was a particularly great lesson that Steve Glassman taught us about not letting other people make slides for you. Thank you.
So this is Çağlar Ilgör, and
my name is Hanjo Kim.
So we just moderated a session on early onset scoliosis and congenital scoliosis. It was a very well attended session with 9 presentations and good discussion. We talked about application of robotics and navigation in pediatrics and new technologies in early onset.
We also discussed some innovations in the sequence of treatment. For example, patients with concurrent tethered cords and spinal deformities, as well as some innovative ways to handle the timing for patients with cervical thoracic deformities.
Hi, my name is Merşen Ercan. I'm one of the co-chairs of the IMAST meeting, and I co-chair this meeting with my dear partner, Dr. Kristen Jones.
Hello. We just finished moderating the last session of IMAST 2025. We had an excellent panel up here. We had Dr. Chris Ames, Dr. Larry Lenke, Dr. Ron Lehman, and Dr. Camilla Molina with a case presented by Dr. Manuel Ferraro. So we had a really engaging panel discussion about technology and its adoption and its pitfalls and how to make it work for you.
Yeah, and that was the final session. So we conclude our IMAST. I hope all the attendees benefit a lot. I feel like it was a really wonderful meeting.
I'm so grateful to have such an awesome co-chair, and thank you to everyone involved. We really appreciate you.